When 23-year-old nurse Jenna Wilson admitted what appeared to be another homeless man into County General's ER, she expected a routine shift. But as she cleaned the grime from his forearm, her breath caught. Beneath the dirt was a tattoo, one she'd only seen in classified briefings during her military nursing training. Her hands trembled as recognition flooded through her. This wasn't just any patient. Within minutes, she made a call that would change everything. 10 minutes later, the thunderous roar of rotor blades shook the hospital windows. Marine One, the president's helicopter, descended onto the lawn, and Jenna realized she'd just saved one of America's most protected secrets. When 23-year-old nurse Jenna Wilson admitted what appeared to be another homeless man into County General's ER, she expected a routine shift. But as she cleaned the grime from his forearm, her breath caught. Beneath the dirt was a tattoo, one she'd only seen in classified briefings during her military nursing training. Her hands trembled as recognition flooded through her. This wasn't just any patient. Within minutes, she made a call that would change everything. 10 minutes later, the thunderous roar of rotor blades shook the hospital windows. Marine One, the president's helicopter, descended onto the lawn, and Jenna realized she'd just saved one of America's most protected secrets. 3 months at County General Hospital had taught Jenna Wilson exactly where she stood. At the bottom, the newest nurse on the trauma floor, the one who got the worst shifts, the overflow bay, the patients nobody else wanted to deal with, the one Dr. Hammond loved to correct in front of everyone. Earlier that evening, he'd stopped her mid-assessment with a cardiac patient. His voice had carried across the entire ER. "You're wasting time with all these questions, Wilson. This is emergency medicine, not a therapy session. Get the vitals and move on." The other nurses had watched, some with sympathy, most with that look that said they'd seen it before. New nurses always thought they were special. New nurses always learned. Jenna was too thorough, they whispered, too emotional, too invested in patients who were just passing through. She'd heard it all during her short time here. She took it, absorbed it, tried to learn from it. But something inside her refused to change completely. Details mattered. Patients mattered, even the ones everyone else dismissed, especially those ones. The call came in at 2:47 a.m., police bringing in an unconscious male found near a subway grate in Brooklyn. Possible intoxication, possible overdose, no identification, no wallet, no phone. Just another homeless John Doe for the overflow bay. John Doe number 47 for the month. Jenna took the handoff from the paramedics. Male, approximately 35 to 40 years old, unresponsive to verbal stimuli, shallow respirations, blood pressure low but stable. The paramedics had started an IV line in the ambulance. They'd done the AFA basics. Now he was hers. He looked like so many others she'd seen, covered in grime, wearing a torn military surplus jacket that had seen better days. His hair was matted, his face was dirty, his hands were calloused and rough. Standard assessment protocol kicked in automatically. Dehydration, possible exposure, minor lacerations on his face and hands, clean him up, IV fluids, observation, discharge by morning if he stabilized. She started with his arms, looking for track marks, signs of drug use, anything that might explain his condition. Hot water, soap, gentle circular motions removing layers of street grime. His left arm was clean. No marks, no scars, no signs of intravenous drug use. Then she moved to his right forearm. She froze. The tattoo emerged from beneath the dirt like a ghost materializing. Small, precise, professional work. An eagle, 13 stars arranged in a specific pattern around it. Not the kind of tattoo you saw every day. Not the kind most people would even notice. But Jenna noticed. Her mind flashed back instantly. 2 years ago. Naval Medical Center, Portsmouth. She'd been assigned to the VIP medical unit for 6 months. Part of her training rotation, they'd given her a security briefing. Classified, need-to-know basis. They'd shown her images, symbols, markings, things to watch for. "If you ever see this marking," the briefing officer had said, tapping the image on the screen, "you are looking at a member of the Secret Service counter-assault team. The design is not public knowledge. It's worn only by elite operators who protect the President of the United States. If you see this tattoo on a patient, you contact the Secret Service immediately. No exceptions." Jenna's hands started to shake. She kept cleaning, forced herself to keep moving, act normal, don't draw attention. But her heart was hammering. What was a Secret Service agent doing unconscious on a Brooklyn street? How did he end up here? Was she wrong? Could she be mistaken? The briefing was 2 years ago. Maybe she was remembering it wrong. No, she remembered. She always remembered details. It was her gift and her curse, the pattern of stars, the eagle's wings, the specific positioning. This was it. This was the tattoo. She looked at his face again, really looked, past the dirt, past the assumption that he was just another homeless patient, his bone structure, his physical conditioning. Even unconscious, even dirty, there was something about him that didn't fit. His muscle tone, his hands. These weren't the hands of someone who'd been living on the streets. Then she noticed something else. Fresh bruising around his ribs. She lifted his shirt carefully. The pattern was wrong, not from a fall. This was defensive bruising, like he'd been hit, repeatedly. His right hand had swollen knuckles, fresh abrasions across the metacarpals. He'd been in a fight, recently. This wasn't exposure, this wasn't intoxication. This was an altercation. She checked his pupils with her. Penlight. Unequal. The right one was more dilated than the left. And it was worse than 5 minutes ago when the paramedics had handed him off. Head trauma, possibly severe, possibly getting worse. Jenna's stomach dropped. She had to tell someone. She had to report this. But who would believe her? She was the rookie nurse everyone dismissed, the one who asked too many questions, the one who saw problems where everyone else saw routine cases. She found Dr. Hammond at the central station, reviewing charts. His 20 years of experience radiated from every movement. He ran this ER like a military operation, efficient, by the book, no drama. Dr. Hammond, she said, keeping her voice steady. Bay 7, I think we need a CT scan. Possible TBI, and there's something else. He barely looked up from the chart in his hands. He's homeless, Wilson. Probably fell. IV fluids and observation. But his injuries suggest a physical altercation. And there's a tattoo that I think might indicate... Are you a doctor now? Hammond's voice carried that edge she'd learned to recognize. Because last I checked, you've been here 3 months. She pushed forward anyway. There's a tattoo. I think he might be... A tattoo? Hammond looked up now, his eyes hard. You want me to order a $3,000 CT scan because of a tattoo? The other nurses at the station exchanged glances. Here we go again. The new girl seeing conspiracies, making mountains out of molehills, getting emotionally invested in patients who just needed basic care. Jenna felt the heat rise in her cheeks, the humiliation, the doubt creeping in. Maybe she was wrong. Maybe she was overreacting. Maybe this was exactly why everyone thought she wasn't cut out for emergency medicine. But the tattoo, the bruising, the head trauma. She walked back to Bay 7, her mind racing. 2 choices: follow orders and hope she was wrong, or trust her instincts and risk everything. If she was right and did nothing, a federal agent could die on her watch. If she was wrong and caused a scene, her career at County General was over. 3 months of trying to prove herself. Gone. She looked at the clock. 3:12 a.m. The staff break room was empty. Jenna pulled out her phone. Her hands were shaking again. There was a number. She'd memorized it during that briefing at Portsmouth. Never thought she'd actually use it. Never thought she'd need to. She dialed. The phone rang 3 times. A voice answered. Board. Routine. Secret Service duty desk. This is Jennifer Wilson, former Navy nurse, Portsmouth Naval Medical. I have a code. She paused, remembering the exact phrase. Code Sentinel. I may have an agent down. The voice on the other end transformed instantly. Bored to razor sharp in half a second. Repeat your last. Code Sentinel? Affirmative. Male, approximately 35 to 40. Cat tattoo, unconscious. Head trauma, County General ER, New York. Stay on this line. Do not disconnect. Do not leave his side. She heard keyboard clicks. Rapid fire. Communication in the background. Multiple voices. Urgent tones. Agent Wilson, your credentials check. We're pulling his tracker now. Hold position. Jenna walked back to Bay 7. Her legs felt unsteady. She'd just done it, made the call. There was no taking it back now. Either she'd saved a life or she'd just ended her career on the basis of a tattoo and a hunch. The patient's vitals were declining. Blood pressure dropping, 110/70, now 105/68. The pupils were more unequal. His breathing was changing, becoming more labored. She started another IV line, drew up medications for a possible seizure, prepared for the worst. Dr. Hammond walked past the bay, didn't even look in. "Still babysitting the drunk, Wilson?" She didn't answer. Just watched the monitor, watched the numbers, watched the clock. 3:18 a.m. Her phone buzzed. Text from an unknown number, 8 minutes out. "Keep him stable. You did the right thing." 8 minutes. She increased the IV fluids, checked his neurosigns, pupil response every 60 seconds. His breathing was becoming more labored, respiratory rate climbing, 24, then 26, then 28. She knew what this meant. Increased intracranial pressure, the brain swelling inside the skull, pressing down, cutting off oxygen. He needed to be intubated, needed a breathing tube, needed it now. But that required a doctor's order. That required Dr. Hammond. She found him again. "Dr. Hammond," she said, her voice urgent now. "He's deteriorating. Respiratory distress. We need to intubate now. Wilson, stop. He's breathing fine. His respiratory rate is 28 and climbing. He's compensating. He's going to crash. Get back to your other patients. If we don't act in the next 5 minutes, he'll code." Hammond turned. His face was red now, angry. "Are you refusing a direct order?" Before Jenna could answer, it started. A sound, distant, rhythmic, thumping, growing louder. The windows started to vibrate, not much, just a little, but enough to notice. Everyone in the ER stopped what they were doing. Heads turned, conversations halted. The sound grew, deeper, closer. The vibration increased. Overhead lights swayed slightly. Papers on the central station started to flutter. That sound, everyone knew that sound. Helicopter rotors, close, too close. Timestamp 3:26 a.m., 10 minutes since the call. The sound became deafening, a physical force pressing against the building. Through the ER windows, bright landing lights cut through the darkness, descending onto the hospital's front lawn. Not the helipad on the roof, the lawn. Right in front of the emergency entrance. This was an emergency landing. Patients stumbled out of their beds. Staff rushed to the windows, everyone pressing against the glass to see. The rotor wash sent trash and leaves spiraling across the parking lot. The landing lights were blinding white, intense, military grade. What the hell's going on?" Dr. Hammond shouted over the noise. Security alarms triggered throughout the building, loud, piercing tones. Something had landed where it shouldn't. Protocol violations, unauthorized aircraft. The whole system was screaming. Then the doors burst open. 6 men in black tactical gear flooded into the ER, moving as one unit, coordinated, precise, professional. They wore body armor, helmets, face shields. Weapons were visible on their hips and across their chests, but held low. Not threatening, just present. Ready, earpieces in every ear, hand signals between them. They spread out across the ER like water, finding every gap. They weren't asking for directions. They weren't stopping at the front desk. They knew exactly where they were going. Leading them was a woman in a dark suit, no tactical gear, just the suit, and an expression that could freeze blood. She had her Secret Service credentials already out, holding them high. Her eyes scanned the room, searching. "Jennifer Wilson?" Her voice cut through the chaos. Jenna raised her hand. Her throat felt tight, her heart hammering so hard she thought everyone could hear it. The woman approached quickly, each step deliberate. "Special Agent Catherine Torres, Presidential Protection Division. Where is he?" Jenna pointed to Base 7, her hand steady despite everything. "Base 7. Dr. Hammond stepped forward, his authority reflex kicking in. "Now wait just a minute. You can't just burst in here and—" Agent Torres didn't even look at him. "Clear this area. Now." The tactical team was already moving, surrounding Base 7, creating a perimeter. 2 agents at the entrance, 2 flanking the bed, 1 at the window, 1 scanning the hallway. Professional coverage, total security. 1 agent pulled out a device, small, handheld. He grabbed the patient's wrist and pressed the device against it. A biometric reader, blue light scanning, numbers scrolling across a small screen. Identity confirmed. Agent Cameron Mitchell, CAT Primary Team. The name hit the room like a shockwave. Mitchell, Cameron Mitchell. Everyone in the ER froze. Even the patients who had no idea who that was could feel the weight of the name, the way the agents reacted, the way their posture changed. This wasn't just any agent. This was someone important, someone critical. Dr. Hammond's face went white, all the color draining in an instant. Agent Torres turned to Jenna, her eyes sharp. Assessing status? Jenna's training kicked in. Every hour in Afghanistan, every emergency, every impossible situation. It all came back. Her voice was steady now, clinical, precise. Head trauma, likely subdural hematoma, declining consciousness, unequal pupils, respiratory compromise imminent. He needs immediate intubation and emergency CT, possible surgical intervention. Time to critical? Minutes, maybe less. Torres looked at Dr. Hammond. "You're the attending?" Hammond nodded, his mouth opening and closing, but no words coming out. "Then why isn't he intubated?" Silence. Dr. Hammond stammered, his authority crumbling. "We were assessing." Agent Torres stepped closer to him. Her voice was ice. "This nurse called it in 14 minutes ago. She identified him by sight, recognized combat injury patterns, and initiated federal protocol. Why didn't you listen to her?" No answer. Hammond looked at the floor, at the walls, anywhere but at Torres, anywhere but at Jenna. Torres turned back to Jenna. "You have emergency intubation training?" "Yes, ma'am. Navy Medical Corps." "Then do it, now." Jenna's hands stopped shaking, just like that, the trembling gone, replaced by something else, certainty, purpose. This she knew, this she'd done. Combat medicine, high pressure, no margin for error, no second chances. She called for equipment. Her voice was commanding now. No hesitation, no asking, telling. Etomidate, 20 milligrams. Succinylcholine, 100 milligrams. Size 8 ET tube. Laryngoscope, move. The other nurses scrambled, running to supply cabinets, grabbing medications, drawing up syringes. They'd whispered about her being too thorough just hours ago. Now they were following her orders without question. Dr. Hammond stood frozen, watching, his face unreadable. Jenna positioned herself at the head of the bed, checked the equipment, every piece, every connection. One mistake could kill him. One error could end everything. Her movements were precise, calculated, perfect. Pre-oxygenation first, bag mask ventilation, filling his lungs with oxygen, buying time, building a reserve, medications administered, etomidate to sedate, succinylcholine to paralyze. She watched the clock, counting seconds, waiting for the drugs to take effect. He's going down, laryngoscope in her left hand, curved blade. She opened his mouth, lifted the tongue, visualized the airway. There, vocal cords, white bands in the red tissue, the target, tube in her right hand. She advanced it, smooth, steady, through the cords, into the trachea. One attempt, clean insertion. "I'm in, inflate the cuff." A nurse handed her the syringe. Jenna inflated the cuff inside his trachea, sealing the tube in place, creating a secure airway, bag mask ventilation. She squeezed the bag, watched his chest, rising equally on both sides, good air movement, no resistance, tube secured. Connect to vent. The ventilator was wheeled over, connected, turned on. The machine took over breathing for him, rhythmic, steady, reliable. Time elapsed. 47 seconds from medications to secured airway. Agent Torres had been watching the entire time. Her expression shifted, impressed. "Where'd you learn to tube like that?" "Forward Surgical Team, Afghanistan, 2019 to 2021. How many combat intubations?" 63. Torres nodded slowly. "That's why you knew." Another agent approached Torres, male, taller. He leaned in close, whispering urgently. Jenna couldn't hear the words, but she could see Torres's face, the way it darkened, the way her jaw tightened. "We need to move him, now. There's a neurosurgical team waiting at Walter Reed." Torres turned back to Jenna. "I need you to tell me everything, every detail about his injuries." Jenna recounted what she'd seen. Defensive bruising, pattern suggests hand-to-hand combat, knuckle abrasions. He fought back. Head trauma from behind, likely blunt object. This wasn't random. "You read combat injuries?" "I've seen enough of them." The CAT team was already moving. They didn't wait for more discussion. Portable monitors appeared, transfer board, straps. They worked with the efficiency of people who'd done this 1,000 times. Agent Mitchell was being prepared for helicopter transport, every movement coordinated, every action precise. Dr. Hammond finally found his voice. He needs a CT first. We can't just... Torres turned to him. Her voice was ice cold. Walter Reed has a trauma OR standing by. The president's personal surgeon is scrubbed in. We're not debating this. She looked at Jenna. You're coming with us. What? You stabilized him. You know his condition. We need continuity of care during transport. Jenna's mind raced. I can't just leave my shift. Torres stepped closer. Her voice dropped, low enough that only Jenna could hear. Agent Mitchell was attacked 4 hours ago while investigating a credible threat to the president. Someone knew his route. Someone knew his schedule. He's been missing for 3 hours, and the only reason he's alive is because you recognized a tattoo most people don't know exists. Jenna's eyes widened. You're saying this was... I'm saying you're the only person who's kept him alive so far. I need you on that helicopter. Hammond tried to regain control one more time. She's my nurse. She doesn't have authorization to... Agent Torres turned. The look on her face stopped him mid-sentence. Dr. Hammond, let me be clear. This nurse potentially prevented a national security catastrophe. She demonstrated assessment skills that saved a federal agent's life. Meanwhile, you dismissed her concerns and delayed critical care. She handed him a card. You'll be hearing from our office, and probably from your hospital's legal team. Hammond's face was ashen, all the color gone, his hands trembling slightly as he took the card. Jenna grabbed her ID badge. Her hands were steady now, completely steady. The CAT team had Agent Mitchell on a gurney, ready to move. The monitors were portable now, battery-powered, self-contained, everything needed for transport. As they wheeled toward the exit, the entire ER staff watched, silent, stunned. The nurses who'd whispered about her, the doctors who'd called her too emotional, the techs who'd exchanged glances when she asked too many questions, all of them watching, all of them silent. Dr. Hammond stood near the central station, silent, pale, diminished. Jenna walked beside the gurney, monitoring vitals, checking the ventilator settings, professional, focused. Through the ER doors, the automatic doors sliding open, the cold night air hit her face, sharp, bracing, real, across the lawn, the grass wet with dew, the helicopter waiting, rotors spinning, the downwash creating a patio windstorm. Papers and debris swirling. The presidential seal visible on the side of the aircraft, Marine One, the actual Marine One, the helicopter that carried the president. As they loaded Agent Mitchell, Torres turned to Jenna. You called this in on your own, against your supervisor, knowing it could end your career. Why? Jenna looked at the unconscious agent, then back at Torres. Because I took an oath, and because I've seen what happens when people ignore warning signs. Torres studied her face. Reading something there. There's a story there. Yes, ma'am. There is. Jenna climbed into Marine One. The interior was nothing like a normal medical helicopter. Plush, equipped, presidential. The door closed behind her. Heavy, solid, sealing them inside. The helicopter lifted, smooth, powerful. Through the window, she could see County General shrinking below. The ER still lit up. Staff still gathered at windows, tiny figures looking up. Dr. Hammond visible on the lawn, a small figure, getting smaller, looking up at the helicopter carrying away his nurse and his massive mistake. Agent Torres sat across from Jenna, speaking into her radio. Package secure. ETA Walter Reed, 11 minutes, alert the surgical team. She looked at Jenna. You said you've seen what happens when people ignore warning signs. Tell me. Jenna's hands gripped the edge of her seat, the vibration of the rotors humming through the frame. Her eyes went distant, seeing something else, somewhere else. Kandahar, March 2021. I was the triage nurse when casualties came in from a patrol ambush. Inside Marine One, the vibration of the rotors hummed through everything. The cabin lighting was dim, intimate, just Jenna, Torres, 2 other agents, and the unconscious form of Cameron Mitchell strapped to the medical gurney between them. Jenna's voice was barely audible over the engine noise. March 14, 2021. 7 casualties from an IED ambush. I was the senior triage nurse. Agent Torres leaned forward, listening, her face unreadable but her attention complete. Jenna's eyes were fixed on Agent Mitchell's monitor, the numbers glowing green in the dim cabin, but she wasn't seeing them. She was seeing something else, somewhere else, a different hospital, a different patient, a different choice. 6 soldiers came in critical, massive trauma. We had 2 operating rooms and 4 surgeons. Her voice was steady but fragile, like ice that might crack at any moment. I had to decide who went first, who waited, who had the best chance. The words caught in her throat. She swallowed, continued. There was a corporal, Daniel Freeman, 23 years old, sucking chest wound, femoral bleed, survivable if we moved fast. She paused. The helicopter banked slightly, the lights of the city passing below. But there was also a lieutenant colonel, 38, combat veteran, abdominal trauma, suspected liver laceration. The memory was so clear, so vivid, like it had happened yesterday instead of years ago. The colonel was senior. He had command presence even on that gurney. He was conscious, giving me his blood type, his medical history. Professional, calm, in control even while bleeding. Jenna's hands clenched in her lap. Freeman was going into shock, fading, but he was just a corporal, young, scared. His eyes were wide, pleading, but he couldn't speak. The chest wound had collapsed his lung. The surgeon, Captain Ramirez, looked at me for the call. 2 ORs, 6 critical patients. I had to triage. I had to choose. Her voice dropped even lower. I sent the colonel in first. Rank, experience, combat record. The decision made sense. It followed protocol. It was logical. Silence in the helicopter except for the rotors and the steady beep of Mitchell's monitor. Freeman waited. 47 minutes. Jenna's voice was barely a whisper now. By the time they got him to OR, he'd lost too much blood. He coded on the table. They couldn't bring him back. More silence. Torres didn't interrupt, didn't try to fill the space with platitudes. The colonel survived, made a full recovery. He's a general now. I saw his promotion ceremony on the news last year. Jenna's eyes were wet, but she didn't cry. Not yet. But Freeman's mother sent me a letter, found out my name somehow. She didn't blame me. That was worse. She thanked me for trying, sent me a picture of Daniel, high school graduation, big smile, proud. He wanted to be a teacher. He had a girlfriend. They were going to get married when he got home. Her voice broke on the last word. I made the wrong call, Agent Torres. I prioritized rank over injury severity. I let protocol override instinct. I knew Freeman was worse. I saw it. But I chose the officer because he seemed more important. There was an inquiry. Standard procedure for combat casualty reviews. They cleared me. Said I followed triage protocols. Said any nurse would have made the same call. Her hands trembled now, shaking in her lap. But they were wrong. I knew Freeman was worse. I saw it in his eyes. And I ignored it because a lieutenant colonel seemed more important than a corporal. I let rank make my decision instead of medical need. She looked up at Torres, her eyes red. I left the Navy 6 months later. Couldn't face another triage decision, couldn't risk making that choice again. Every patient I see, I wonder if I'm missing something. If I'm letting the wrong person die because I'm following rules instead of trusting what I see. Agent Torres was quiet for a long moment. The helicopter began its descent toward Walter Reed, the city lights growing brighter below. How many patients did you save that day? Jenna looked confused. What? How many patients did you save? That day in Kandahar, how many walked out alive? 5. 5 survived, 1 didn't. 5 families have their loved ones because of you. That's not nothing. Jenna shook her head. But Freeman was already dying. You know that. Femoral bleed, shock, 47 minutes. You gave him his only chance. You got him to OR. The outcome wasn't your fault. Torres leaned back, her expression softening slightly. You know why you called in Agent Mitchell tonight? Because I recognized the tattoo. No. You called him in because you weren't going to let rank or hospital politics kill another patient. You learned from Freeman. You learned to trust your instincts over protocol. Jenna looked up, tears in her eyes now, really flowing. You saw what mattered. Not that he was homeless, not that your supervisor dismissed you. You saw the injuries. You trusted your instincts. That's why he's still alive. Torres's radio crackled, a voice coming through. Package plus 2 minutes to Walter Reed, surgical team standing by. she responded with a quick acknowledgement, then turned back to Jenna. I need to tell you something about tonight, about what happened to Agent Mitchell. Jenna wiped her eyes with the back of her hand. You said he was investigating a threat. 3 days ago, we received intelligence about a possible assassination attempt. Credible source, specific details, enough to take seriously. Jenna felt a chill run down her spine. Agent Mitchell was running a parallel investigation. Off book. He suspected the threat was coming from inside the security apparatus. Inside. Someone with access to presidential movements, Secret Service protocols, secure communications. Someone who knows how we operate, how we protect, where the vulnerabilities are. Torres's face was grim, hard. Tonight, Mitchell was following a lead. He was meeting a source, someone who claimed to have evidence, names, proof. He never made it to the meeting. We found his car abandoned in Brooklyn, engine still running, door open. He disappeared. The location where police found him, 8 blocks from his last known position, in an alley, beaten, left for dead. Someone grabbed him, interrogated him, tried to kill him. Jenna's stomach turned. The head trauma? Deliberate. They wanted information, then they wanted him dead. If he died in that hospital, it would have been written off as a homeless John Doe. Case closed, investigation over. But you saw through it. You saw the tattoo. You saw the combat injuries, the defensive wounds. You recognized what everyone else missed. Now he's alive. And someone is very unhappy about that. Jenna felt ice in her stomach. I mean whoever did this knows he's still alive by now, and they know someone saved him. Torres pulled out her phone, swiped to a photo, turned it toward Jenna. Security camera footage from County General's parking lot. Grainy, black and white, a dark sedan, no plates, just circling. Over and over. Timestamp, 3:42 a.m., 16 minutes ago. This car arrived 7 minutes after we took off. It's been circling the hospital. Watching, waiting, someone was watching. Someone knows you made the call. Are you saying I'm in danger? Torres's expression was serious. I'm saying you've just become a witness to an attempted assassination of a federal agent. You can identify his injuries, testify to the deliberate nature of the attack. You can confirm he was targeted. Not random violence. More than that, you saved the one person who might know who's behind the threat to the president. The helicopter began to descend. Jenna could see Walter Reed below. Massive, sprawling. Medical teams already waiting on the helipad, ready. Torres handed Jenna a card. When we land, you'll be debriefed. You'll need to tell them everything you observed, every detail, every injury, everything. After that, we can arrange protection, safe house, new location if necessary, until we identify the threat. Jenna stared at the card. I just wanted to save a patient. You did. And now you're part of something bigger. Marine One touched down on Walter Reed's helipad. Smooth, professional, the rotors still spinning. Medical team rushing forward with a gurney, portable monitors, transfer equipment. They moved with military precision. Agent Mitchell was unloaded, rushed toward the building. Jenna followed, her legs unsteady, the adrenaline starting to wear off, exhaustion creeping in. Through the hospital doors, fluorescent lights, bright, almost blinding after the dim helicopter. The familiar smell of antiseptic, disinfectant, hospital smell, universal. But this wasn't County General. This was Walter Reed National Military Medical Center. Security everywhere. Men in suits with earpieces, military personnel in uniform, cameras, checkpoints. This was a different level entirely. They wheeled Agent Mitchell down a hallway, toward the surgical wing. A surgeon met them halfway, scrubs already on, surgical cap, ready to go. He looked at the monitors, at Mitchell's vitals, professional assessment, but before they could transfer care, something changed. The monitor alarm screamed, high-pitched, urgent. Mitchell's blood pressure was plummeting. 110/70, then 90/60, then 80/50, dropping fast. He's crashing, someone shouted. The surgeon looked at the monitor, his face darkening, internal bleeding. He's hemorrhaging. He turned to Torres. How long ago was he injured? Torres looked at Jenna. Jenna stepped forward, her training overriding her fear. Initial trauma approximately 4 hours ago, secondary decline 30 minutes ago, possible delayed splenic rupture or retroperitoneal hematoma. The surgeon looked at her sharply. You're the triage nurse? Former Navy, forward surgical team. Then you know what this means. He needs an OR. Now. Massive transfusion protocol. He might not survive transport to the surgical suite. The surgeon looked around. At the hallway, at the elevators. We're 2 minutes from OR, but if he codes in the elevator, then we don't wait. We crack his chest here. Everyone stared at her, stunned, shocked. Emergency thoracotomy, opening the chest cavity in the hallway. It was a last resort procedure, extreme, dangerous, high mortality. But sometimes it was the only chance, the only option when someone was bleeding out internally and there was no time to get them to an operating room. The surgeon's eyes met hers. You've done this before? Twice. Both in combat. One survived. Agent Torres grabbed the surgeon's arm. Doctor, if Agent Mitchell dies, we lose our only lead on a credible threat to the president. If he survives the next 10 minutes, he can tell us who tried to kill him. The surgeon nodded. Decision made. Then we do it here. He looked at Jenna. I'm Dr. Castellano. You're with me. Everyone else, clear this hallway. We need a sterile field. Now. The Walter Reed hallway transformed into an emergency surgical suite in seconds. Staff cleared the area. Equipment appeared from nowhere. Surgical trays, sterile drapes, suction units, everything moving with military precision. Jenna scrubbed in. 30 seconds, surgical soap, muscle memory taking over. Her hands moving automatically through the motions she'd done hundreds of times. Lather, rinse. The familiar ritual that prepared the mind as much as the hands. Dr. Castellano was across from her, 2 surgical nurses flanking them, Agent Mitchell on the gurney between them, his vitals declining. Blood pressure 60/40, heart rate 140, respirations 32, the numbers screaming danger. He's got minutes, Castellano said, maybe less, scalpel. Jenna's hand was steady now, no tremor, no doubt. This was what she was trained for. This was the moment all those hours in combat had prepared her for. She made the incision, left chest, between the ribs, clean, precise, deep, rib spreader. The nurse handed it to her. Jenna positioned it, turned the crank. Metal cracked ribs apart, the sound sharp, final, opening the chest cavity, exposing what lay beneath. Blood, so much blood, dark, venous, pooling, flowing, the chest cavity filling faster than they could suction. I see the bleeding, intercostal vessels, massive tear. Can you clamp it? Castellano asked. Jenna's hands worked inside Mitchell's chest cavity, her fingers searching, feeling, finding, the torn vessel, ragged edges, pulsing with each heartbeat, pouring blood into the space where air should be. Clamp now. The nurse handed it to her, cold metal against her palm. Jenna positioned it, found the vessel, closed the jaws, click, secured. The bleeding slowed, not stopped, but controlled, manageable, suction. I need to see the heart. They cleared the blood, suctioning away the dark fluid, revealing what lay beneath. Mitchell's heart was visible now, still beating, but weak, struggling, the chambers not filling properly. Cardiac tamponade, blood in the pericardium. I need to drain it. Jenna inserted a needle into the pericardial sac. The thin membrane surrounding the heart. Dark blood flowed out through the needle, thick, under pressure. The heart was being compressed, squeezed, unable to beat effectively. The heart responded immediately. Stronger beats, more forceful. The chambers filling properly now that the pressure was released. Pressure's coming up, one of. The nurses shouted, BP 80/50, 90/60, stabilizing. Castellano looked at Jenna with something like awe. You just saved his life, in a hallway, with a chest tube and a clamp. Jenna didn't respond. She was focused on Mitchell's vitals, watching the numbers, making sure they held. Heart rhythm is strong, bleeding controlled. He's stable enough to move. Then let's get him to OR and finish this properly. They moved Mitchell to the surgical suite. Jenna kept her hand on the clamp. If it slipped, he would bleed out in seconds, through the doors, into the OR. Full surgical team waiting, lights, monitors, everything ready. Transfer on my count, Castellano said. 1, 2, 3. Mitchell was moved to the operating table, smooth, coordinated, professional. Jenna released the clamp to the OR surgeon. He's yours now. Jenna was escorted to a private waiting area, still in blood-soaked scrubs. Mitchell's blood, dark, drying, cracking when she moved. Her hands finally started to shake. Post-adrenaline crash, the body's response to sustained crisis. She couldn't stop them. They trembled in her lap. Agent Torres appeared with coffee. You did it again. Is he going to make it? Castellano says yes. Full recovery expected. Thanks to you. 2 other agents entered. 1 male, 1 female. Both in dark suits. Professional. Serious. Ms. Wilson, the male agent said. I'm Special Agent Davis. This is Special Agent Chen. We need to ask you some questions. For the next hour, Jenna recounted every detail. Mitchell's injuries, the attack pattern, the timeline, her observations, her medical interventions, everything she saw, everything she did. They recorded it all, taking notes, asking clarifying questions, building a case. When she finished, Davis exchanged a look with Torres. Your assessment of his injuries matches what Mitchell told us before surgery. Jenna sat up straight. He was conscious for 90 seconds before they took him under. He confirmed your analysis. He was attacked by 2 men, both with combat training. They were interrogating him about his investigation. Did he tell you who sent them? Davis shook his head. He didn't know, but he said one of them had Secret Service credentials. The room went cold. The air itself seemed to freeze. Secret Service credentials, internal threat, traitor, someone on the inside trying to kill the president. That's confirmation, Torres said. The threat is internal, which means everyone is suspect, including people at this hospital. What does this mean for me? Jenna asked. It means you're not going back to County General. Not tonight. Possibly not ever. We're placing you in protective custody. Safe house, armed detail. Jenna's world tilted, the room spinning slightly. For how long? Until we identify the leak and neutralize the threat, but my job, my life. Your life is what we're trying to protect. You're a material witness now. You can identify Mitchell. You can testify to the attack pattern. That makes you a target. Before Jenna could process this, the door opened. A man in a dark suit entered, different from the others. Authority radiated from him. Everyone in the room stood immediately. Torres snapped to attention. Even Davis and Chen straightened. Jenna realized this was someone important. Very important. Ms. Wilson, the man said, I'm Chief of Staff to the President. I understand we owe you a significant debt. Jenna didn't know what to say. I was just doing my job, sir. Your job was at County General. You went far beyond that. You risked your career, defied your supervisor, and trusted your instincts. He handed her a folder. Official, heavy paper, federal seal embossed on the front. The President would like to thank you personally, once this situation is resolved. But in the meantime, we have a more immediate matter. He opened the folder. Official documents, forms, federal employment paperwork. The Secret Service medical unit is expanding. We need trauma specialists who can work in high-stress environments, maintain operational security, and make critical decisions under pressure. Jenna's eyes widened. She couldn't speak, couldn't breathe. Agent Torres recommends you for the position. So does Dr. Castellano, and so does Agent Mitchell. He sent word from recovery. This would be a federal position. GS-12 grade, with immediate advancement potential. You'd be assigned to the Presidential Protection Division's medical team. You'd travel with the President, provide emergency medical care for the first family and protection detail. It's dangerous work. The hours are brutal. And you'd be on call 24/7. He paused, letting it sink in. But you'd also be working with the best, and you'd be serving your country at the highest level. Jenna looked at the folder, then at Torres, then at the Chief of Staff. What about County General, Dr. Hammond? Torres smiled slightly. Let's just say Dr. Hammond is having a difficult morning. Hospital administration is very interested in why he delayed care for a federal agent. He's been placed on administrative leave pending investigation. And the other nurses, the ones who doubted me? They're currently being interviewed by our office. I think you'll find their attitudes have evolved. Jenna looked at the papers. A federal job, presidential detail, the highest level of emergency medicine. This was what she trained for. This was what she left when she walked away from the Navy, the thing she thought she'd lost forever. When do I start? The Chief of Staff smiled. You already did. Tonight. Consider the hallway thoracotomy your field test. You passed. Jenna signed the papers, her hand steady, her signature clear, final, binding. Torres pinned a temporary ID badge on her scrubs. Welcome to the Secret Service Medical Unit. You're one of us now. What's my first assignment? Agent Mitchell's recovery. You stabilized him twice. You stay with him until he's out of the woods. Understood. Torres walked Jenna back toward Mitchell's recovery room. You know, you remind me of Mitchell. He wasn't always Secret Service. What was he before? Marine sniper. 3 tours. He left after a mission went wrong, lost his spotter, blamed himself. Jenna stopped walking, her chest tight. He came back because someone gave him a second chance, told him his guilt was proof he cared enough to be better. Torres looked at Jenna. I'm telling you the same thing. Freeman's death made you a better nurse. Don't waste that. Jenna entered Mitchell's post-op suite. He was unconscious, intubated, but his vitals were strong, steady. She checked his monitors, adjusted his IV, professional habits, comforting routines, the things that made sense when everything else was chaos. A nurse entered. You're the one who saved him? Jenna nodded. He's lucky you were there. Most nurses wouldn't have recognized the signs. I've seen combat injuries before. The nurse looked at her badge. Secret Service Medical? Welcome to the team. Jenna's phone buzzed. Text message from unknown number. She opened it. This is Dr. Castellano. Wanted you to know. Mitchell's stable. Full recovery expected. Your thoracotomy was textbook. Best field intervention I've seen in 20 years. If you need a reference for anything, call me anytime. She saved the number. Another text immediately after. This is Special Agent Torres. Check your email. Jenna opened her email on the hospital computer. Subject line. Regarding today's events, Hospital Administration, from County General Medical Center, Chief of Medicine. Dear Ms. Wilson, we have been informed by federal authorities of your extraordinary actions this morning. Your clinical judgment and decisive action prevented what could have been a catastrophic failure of care. The email continued. We are conducting a full review of the incident, including Dr. Hammond's decision-making. Please know that your concerns were valid, your assessment was correct, and your actions were heroic. We would like to discuss your return to County General at your earliest convenience, with a promotion to senior trauma nurse and a formal commendation for your service. Jenna closed the email. She wasn't going back. That chapter was over. Finished, done. 3 days later, Agent Mitchell was awake, extubated, sitting up in bed, color back in his face, strength returning. Jenna entered for her shift. He looked at her. You're the one who recognized my tattoo. Yes, sir. Torres told me everything. The call you made, the fight you put up, the thoracotomy. He extended his hand. I owe you my life. Jenna shook it. Just doing my job, sir. Not just a job. You went against orders, risked your career. That's courage. They told me about Kandahar, about Corporal Freeman. Jenna's face fell. Sir, You made a triage call. So did I once. Chose the wrong hostage to extract. Rookie sniper. I went for the diplomat instead. The kid died. He looked out the window. I left the Marines. Couldn't pull a trigger for 2 years. Thought I was done. What changed? Someone told me guilt means you have a conscience, and people with consciences make the best protectors. Mitchell leaned forward. I need to tell you something about why I was attacked. Jenna pulled up a chair. 3 days before the attack, I received an anonymous tip. Someone on the inside was planning to sabotage the president's security detail during an upcoming foreign trip. The tip came with proof. Internal emails, security schedules, things only a handful of people could access. I was tracking the leak when they grabbed me. They wanted to know who sent the tip. They wanted names. I didn't give them anything. But they know I'm close. Which means they'll try again. And now that you're on the medical team, you're part of the protection detail. I'm a target. We're all targets. That's the job. But you're also part of the solution. He handed her a folder. Classified documents, red stripe across the top. Torres cleared you for this. We need someone on the medical team who can think tactically, who can read injuries, assess threats, spot inconsistencies. You saved my life by noticing details others missed. We need that skill. Over the next week, Jenna trained. close quarters medical protocols, tactical casualty care, threat assessment, working alongside agents who were once Marines, Army Rangers, Special Forces, warriors, protectors. She found her place among them. They accepted her without question. She'd proven herself. 3 months later, presidential motorcade, overseas diplomatic visit, Jenna in the medical support vehicle, full kit, radio earpiece, ready. Agent Mitchell, fully recovered, was in the lead CAT vehicle. Medical 1, this is CAT primary, status check. Medical 1, all green, standing by. The motorcade moved through the city, crowds waving, security tight. Jenna watched the screens, security camera feeds from the route. Something caught her eye. A vehicle, wrong color, wrong position. CAT primary, suspicious vehicle, 2 o'clock, black sedan. I see it. Running plates now. Pause. Plates are flagged. Stolen vehicle. All units. Possible threat. The motorcade shifted formation. Counter-assault teams deployed. The suspicious vehicle was blocked, surrounded. Driver taken into custody. False alarm. Wrong place. Wrong time. But the protocol worked. Good catch, Medical 1. That's why you're here. Jenna smiled. 6 months ago, she was a rookie nurse being dismissed by her supervisor. Now she was part of the most elite protection force in the world, saving lives, protecting the president, using her trauma to fuel her purpose. Back at County General, Dr. Hammond watched the news. Report about the president's successful diplomatic trip, brief mention of the Secret Service medical team, a photo flashed on screen. Jenna Wilson, full Secret Service uniform, standing beside Marine 1. Caption, Secret Service Medical Unit, expands with combat veterans. Hammond turned off the TV. In his office, a letter from the hospital board, formal reprimand, mandatory. Retraining on trauma protocols, 6 months of probation. Jenna's phone rang. Torres calling. Turn on the news. Channel 7. Breaking news. Federal authorities announce arrest in Secret Service conspiracy case. Footage of agents escorting a man in handcuffs. The reporter speaking. The suspect, a former Secret Service administrator, is charged with attempted murder of a federal agent and conspiracy to compromise presidential security. They got him. Mitchell's testimony sealed it. Your medical analysis of his injuries proved it was an organized attack, not random violence. We did it. Jenna stood in her apartment, new place, secure building, federal housing, on her wall, her Navy uniform, her County General ID badge, her new Secret Service credentials, a photo of her trauma team from Afghanistan, a letter from Corporal Freeman's mother, a certificate from the president thanking her for her service. She looked at Freeman's photo. I couldn't save you, but I'm saving others now, every day, in your honor. Her phone buzzed. Text from Mitchell. Medical briefing tomorrow, Oro 600 presidential trip to summit conference. Bring your A game, always. She suited up for her shift, Secret Service jacket, medical kit, radio. She looked in the mirror. This was who she was now, not the rookie who was dismissed, not the nurse who made a mistake, the guardian who trusts her instincts, the protector who never gives up, the one who recognizes the signs others miss. Final scene. Jenna arriving at the White House Medical Unit. Marine guards saluted her. She entered the briefing room. Mitchell was there. Torres, the full medical team, planning for the next mission, protecting the next life, stopping the next threat. And Jenna Wilson, once dismissed, now essential, was exactly where she belonged, at the front line, saving lives, making a difference, one patient at a time.